Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You are watching Conversations with Jennylyn, and as always, I try to bring you the best people, the best stories, and the more inspiration that I can. Today, I am happy to introduce to you Dr. Peyman Sardari Nia, and he lives in Belgium, works in the Netherlands, so he is going to be able to share stories with us from both countries. Dr. Peyman, thank you so much for taking the time during this difficult time in our lives to spend this time with me.
Thank you so much for having me on your show.
I am very grateful to have
be
you.
able to talk to you.
I'm very grateful to have you. So let's talk a little bit about you before we talk about the master that's controlling the world at the moment,
Yes.
famous Corona. Are you from Belgium or are you Dutch?
No, I'm Persian. I grew up in Netherlands, Holland, and at some point I went to study in Belgium, and I did my MD, PhD, and also my clinical, and I stayed living in Belgium, but I work now in Netherlands, Maastricht. But Maastricht is a city very near the border of Germany and Belgium, so
Okay.
just 5 miles from Netherlands where I live.
And what is your specialty for people who don't know?
So I'm a cardiothoracic surgeon, which is so I'm a surgeon of the heart and the thorax, the lungs.
Wow.
So I work in Maastricht. It's an academic hospital. So I'm also a PhD. So I'm doing a lot of clinical work, but also I'm doing research and education surgeons. So that is actually my daily work.
Well, I feel especially lucky that you can spend this time with me during the Corona crisis, especially because you are a thoracic surgeon. I would imagine you're very busy, since based on my knowledge of this disease, it really attacks the lungs.
Yes, of course. But I mean, those patients are not operated on. So basically, with regard to the thoracic surgery, I'm more doing surgery of oncological basis, so lung cancer.
Okay.
But of course, our hospital has a large number of patients with Corona at this time. So it's not that I'm directly involved in the care of those patients, but of course, my colleagues and especially those working on ICU and other disciplines. Because what I'm doing is always continuous, because you have always people having problems with the heart, so you need an urgent operation. And so a lot of elective cases, elective surgical procedures are of course cancelled. So because of the Corona crisis, but those patients needing an urgent operation, or they have a cancer of the lungs, we try to help them even in this crisis, of course.
What is it like in the hospital where you work in terms of the Corona cases that you're aware of?
So fortunately, we were very well prepared. So before having even the first patients, we had already allocated the department to these patient groups. We had a contingency plan, team involving planning and everything. We cancelled almost all elective medical surgeries or elective things that would make it difficult to admit patients with corona because we had anticipated a high influx of patients. So, but of course, I mean, you can imagine that those admitted to the hospital have, of course, most of them, many of them, are going to admit at ICU. It's a very high care unit, so it's a very intensive for those working on ICU. And because of the large influx, we don't have one patient or two patients doing that, but 40, 50 patients at the same time.
I can imagine.
So even at this moment, because we have in the front of the hospital a Congress Center, and the hospital has built a large department, more than 300 beds or almost 300 beds for corona patients to be able to, if we have a larger influx, to use that.
Were you using all? Have they used all the 300 beds? Because it's
No, not yet.
Pardon?
Not yet.
Oh.
I think, but I mean, this is for because you cannot plan this. You cannot. You just have to be able to have plans so that your healthcare system doesn't get overwhelmed.
Mm-hmm.
Everything what we are doing is actually all the social distancing, the lockdowns, everything you call it. It's all meant to try to create a condition that we would be able to treat the patients that need care with the corona. And if we don't do that, then we can treat them, and then we'll have many people dying from disease because of the fact that your system is overwhelmed.
Have you ever seen anything like this in your lifetime?
No, not yet. And I think that this is, of course, this is a very highly transmittable virus. And the issue is that at this moment we don't have any treatment for it. We don't have any vaccine. So the only thing that we can do is to treat patients, and at the same time try to organize the society as such that we are able to treat them.
So basically, what we're doing is controlling their symptoms.
Yeah, most of the time, because this at the end is the body and the immune system that needs to overcome it.
Mm-hmm.
Of course, it's a very complicated subject because we see in some patients an overreaction of the immune system. So
Mm-hmm.
we don't know a lot of this about this disease.
You said you see an overreaction amongst the patients, their immune system. Did I hear you right?
So what I hear and what I read is that in some patients, I mean, your immune system needs to fight the disease, the virus. Sometimes it is possible at some phase of the disease that your immune system overreacts. So it means that it's damaging your lungs, your tissue.
I see. Okay.
So that is also one of the underlying signs that we see in some patients. But at the end, I think what I think can emphasize and is important is that at this moment, continuously scientists around the world, they are doing research and they're publishing their results. And some of them get reported in the media, but at the end, we don't know anything about this. We don't know many things. Because at the end, what is important in science is reproducibility. So if something gets published, somebody has a finding, other groups should also see whether that is correct, it is reproducible. So because of this virus being here for a few months, that is not possible. So at the same time, what we are doing is also we are trying to see all the create all the dots, but I mean that takes time. Developing a vaccine and treatment. So the main message towards everybody should be have to be mindful what we read in the media, and also
Right.
listen to the guidelines
Mm-hmm.
that are from the official agencies, because those are based on the knowledge of what we have over decades about viruses. And so there are many rumors that if you eat that or if you drink that.
Exactly. That's why we're doing this.
Yeah, so that should be, I mean, as a doctor, physician, I can say that is very important to emphasize on.
Yeah.
It doesn't mean that what is being published or what is being said is not true. It's just the fact that we haven't had enough time to have solid, credible knowledge as we have for other diseases, and that's why it's being very difficult. Right?
One of the reasons that I had the idea to do this show is because I've had some very frustrating conversations with people that I respect who are very educated, and they're so convinced that this is a conspiracy. And because the news always has a slant, I thought if I could find somewhere in the middle and get the truth from people, that would really help. Only because I hope it will eliminate some aspects of fear that people are struggling with at this time. I think if you sit in front of the television and watch the news all day, it's terrifying when you hear the reports that are coming in from around the world. So I thought it best to get the information from someone like yourself. I must ask you this. I would be remiss if I didn't. Are you concerned for your well-being as well as your counterparts? Do you feel that you can really adequately protect yourself always from this disease?
Of course, you have to be mindful, and you are worried about yourself and your loved ones. That is natural. You have to be. That's also very important, because if you don't care, you are not going to uh, follow any rules or guidelines. So,
Right.
uh, but this is the problem with this virus is, based on what we know, is it is possible, and I say possible, that 25 to 50% of patients are asymptomatic. So they don't know they have the virus.
Right.
At the same time, this seems to be very highly transmittable disease. So you get it very easily. And so in a sense that's why there is so many restrictions that you should follow. And of course, in the hospital, uh, because of the fact you have a lot of those patients, a lot of healthcare professionals working with those patients, they are at risk. So you have more chance of getting the virus. I mean, sounds logical, but at the same time, in the hospitals, uh, because it is our profession, we have many guidelines, and we are really mindful of the things that we need to do to be able to continue our work in a safe manner. So we have at our hospital at this moment enough material to protect ourselves.
Right.
Some there were some issues with the masks, but even one of guy from the hospital, he created a new method to re-sterilize the masks, which
Share that. You may
yes,
help other doctors around the world. Would you mind sharing that method so that maybe someone else watching my show in another country?
yes, of course. I mean, I will send you the link. It was also shared on the link.
Okay, great.
So, and I hear that also in the US and other countries, they have also found methods to do that in a very safe manner.
Okay.
Still, but I'm talking about the N95 mask. There was
Right.
special mask.
We have a shortage of those. Well, we had. I don't know if we still do. Can you believe we have a shortage of masks?
Yeah.
One of our hospitals, Stanford Hospital, I'm sure you've heard of Stanford Hospital. I know a nurse working there who's working without a mask. I could not get over that we would have a shortage of masks. So clearly we were not as prepared as it sounds like you guys were.
No, I think nobody was prepared. Nobody was prepared because the magnitude of this crisis is so great that this is beyond of anybody's expectation.
Mm-hmm. Mm-hmm.
I mean, of course, I'm not knowledgeable about what you need to have as a plan in place for something with this magnitude, but you can imagine if you have something like this happening in over 150 countries at the same time, and they all want masks, have things, ventilators, so then you will have problems with supply. So it is not unexpected, I think.
Right.
Especially if you think about that, the last time something like this happened was 100 years ago.
Right. Well, it's creating a lot of material for humor, because I don't know if you've seen some of the homemade masks that are going around.
I haven't seen it.
Okay, it's very funny what they're doing, how they're coming up with some of the face masks.
Oh, really?
Yeah, that people are wearing.
No, I can assume. I mean, this is a good material to
of
make
course.
fun of.
Yeah, and I think it's great that people can find humor in this, and that's what keeps me going. Is all the funny stuff that goes around about this. Have you or anyone, well, not you, but has anybody in your hospital where you work, any of the healthcare providers have contracted the virus?
Yes, yes.
Really? And how are they doing?
I was doing fine, but we had some of my direct colleagues that they were positive, but they had very mild symptoms.
Okay.
At quarantine 2 weeks at home. But we had also a case that a colleague had to be admitted to the ICU. So you have both extremes. And that is, of course, put a lot of pressure for those who are working there. So.
Are they okay now? Are they going to be okay?
Yes, yes.
Okay, good. I'm happy to hear that. What are your numbers like in Holland today? Do you know? And Belgium?
Yeah. So I think we have around 20,000 positive cases, but we don't test all of them.
Okay.
So the testing is really limited to those who need admission to the hospital.
Mm-hmm.
And healthcare workers, of course. So there are many patients who have been probably infected with the virus and had a mild symptom.
Right.
They
So
just
would you
had
say
to stay at home.
So would you say? Sorry.
Sorry.
I thought you finished. No, you can. I'll wait for you to finish.
So, and I think around 2,200 people have died so far. and almost the same number in Belgium.
So would you say the numbers are declining in terms of deaths?
So in a couple of, we see that in the previous days there is some kind of stabilization,
Great. I'm
and
happy to hear that.
we see that actually in those cases being admitted to the hospital, because the cases that being positive tested, that is not reliable, because you don't know how many people have been infected, because you don't test everybody. But at least this hospitalization are stabilizing. That is a good thing. Because, otherwise, I mean, you cannot cope with the influx,
Right.
because those patients being admitted to the ICU, it is not for 1 day or 2 days, but for 2-3 weeks. So,
I know that there's so much life going on around us every single day. What does it feel like for you when you walk out, when you walk in? Even hospitals seem sort of empty. And when you go out into the streets, it's just like life has halted. Is it that
yeah,
way where you are? Is that the same? Are people taking quarantine seriously there?
yeah. I mean, it is almost in Belgium is mandatory. It is almost a lockdown. So you're only allowed to go to work. I mean, if you are doing essential things, works, and then or to the grocery. So in a sense, yeah, I mean, it is incredible. You walk on the street, or if I go to the hospital, it's unimaginable what you see. The streets are empty, no traffic.
It's surreal. It's
It is
so
like,
unprecedented. It's so surreal. And the thing is that it's invisible. You can't take a gun and go shoot it. You cannot terminate it because you don't even understand its structure. So it's sort of frightening. You know what I relate this to is the very first earthquake I experienced when I moved from South America to San Francisco. They had that huge earthquake that caused the bridge to collapse. And I remember sitting in my home thinking, I'm totally at the mercy of what's happening around me. I have no control just to try to keep myself and my family safe. And that's sort of how this virus, a similar type feeling, because you have to make sure you keep yourself quarantined. But as in your case, you are a healthcare provider and you work in the hospital system, and your counterparts do as well. And apparently everybody's been following the protocol to protect themselves. However, they still got contaminated. And so clearly we're all at the mercy of this virus. If we're in the wrong place at the wrong time, it seems like you could end up picking it up. You can get it from a package. You can get it from a cart, from a door. And these are things that we subconsciously use throughout our lives. And so we continue to do them, except we need to remember that we have to be cautious and wash our hands after. Do you find when you go into the hospital system, where do you start your protection? Is it before you come in or after you get in? Like, do you put gloves on? What is it like for a doctor in this time of
yeah.
course?
So normally is that if we enter the hospital, normally you don't think about little things that touching
Right.
or just wanting to take the lift. So we have to be mindful what you touch. That is one thing. Everywhere you go. The other thing is that if you are interacting with patients, people, with anybody, it's quite different than it was before, because you have to keep distance. You have to try to think of all those things that you normally do and you don't need to do. touching your hand, face, and so on. So one part of protection is that, of course. The other thing is that it's always in the hospital very strict that you have to wash your hands, sanitize your hands. If you have any patient contact, that is something inherent to what we do. But of course, because of the coronavirus, everybody needs to do that.
Mhm.
But you cannot have people not applying those things. And the other thing is in the OR, of course, we have to be more protective because of the fact that you don't, you have much more intense interaction with patients. So special masks for some sort of operations. So these are at multiple levels. And then, of course, if you come back at home, so you have to be mindful of
What you're
the
bringing
fact that
home.
you don't want to bring it home. So,
Right.
so it is
So
quite different than it was.
I know you have to just be mindful all the time, cautious all the time. I've heard that countries where people have had the BCG vaccine, which I have, they haven't had as many cases,
Yeah.
positive cases of the coronavirus. Have you heard this? And what do you think? Is it true?
I read the study. So as I indicated previously, there are many studies being published and research being done. This particular study was even reported in the New York Times, but the study is not really officially published. So if we send something for publication, it has to be assessed by other experts, and then it gets published. But this was already in the media before being published.
Got
So
it.
what they have found, and maybe it is correct, but they have found that in some countries that they have BCG vaccination, the case fatality, the mortality rate is lower. And they have found a correlation, what we call correlation. So what does it mean? If you measure the length of your arm and your length of your leg, so if you find a correlation between those, but it doesn't mean it is causal. It doesn't mean that your length of your arm causes your legs to be longer. It has to do with the length.
Right.
So they have found a link, correlation, and that is being reported in the media, but nobody knows is that a real relation between these two. But there are two big studies being done in real patients and even in healthcare providers. One, I think, in Netherlands, and one in Germany. So they are giving some healthcare providers or patients the vaccination. The other half, they don't give it, what we call randomized control trial.
Right.
At the time, the results of those studies are more conclusive.
Okay.
So what they have found is in the link, and they are looking into that.
Okay.
But there's nothing definitive.
Mm-hmm.
That is also the danger, because nowadays find so many people being opinionated, and they share a lot of things that being done research on in the media. But we have to be careful because it's still very early to know that. But I mean, if that is the case, you are lucky, and me too, because I have the BCG.
Well, the reason I asked you, and I'm buying into it, because I was raised in South America and the Caribbean islands, and we were all given the BCG shot. And when I look at the number of cases in those countries where the medical system is not as complicated as it is in some of the countries here, in this part of the world, they haven't had as many fatalities. They haven't had as many cases, and so as just by deduction, I'm
Yeah,
suspecting there could be some truth to it. So we'll have to wait
yeah.
and see what the studies will publish. But I was going to ask you if you could explain to me what the RDS, respiratory distress syndrome is. I have
Yeah.
a friend who's a cardiologist. They told me to ask you this question.
So basically, what happens is that um, so your lungs they need to extract the oxygen from the air that is
Mhm.
inflated into the blood, and so what you have is actually human being has the surface of the lungs that extract oxygen. You can compare it with the surface of two uh, football fields. So big is it. So at some point, if the infection or any disease destroys the lung tissue in such a way that that tissue is not functional anymore.
Mhm.
So normally, if you take an X-ray uh, of the chest, you see only air, you see only almost black, and that results in dysfunction of a large portion of the lung tissue. And that is a very serious condition because those patients are in extreme need of oxygen, which is otherwise it is body is not compatible with life. Now that's why they need a ventilation, and it is something very serious because this can move on into a more serious condition that also affects all the organs of the body, and it is also something that can be reversible. That's why we need ventilation to give time to the body, to the lungs to recover.
Is this prevalent?
Very
Is this
sorry,
prevalent in smokers?
no, no. RDS is a condition that can happen with many conditions.
Okay.
Smoking is something that destroys the the structure of the lungs from inside. So you can imagine that normally you have millions or many small balloons that they are filled with air, and the surface of the balloon is actually you can consider of many blood vessels that extracting actually the oxygen. And what happens in smoking is that the balloons will get destroyed, so you have bigger balloons. So in that fashion, you cannot extract in an efficient way oxygen. On an ARDS, what happens is most of these balloons are filled with water, so the oxygen cannot go to the small, what
Got
we
it.
call alveoli. They are almost uh, filled with water, and the air cannot really get where it should be. So, and in smoking, the air gets in the lungs, but I mean, the lungs cannot extract it because the tissue has been damaged in a different
Right. Whenever I'm speaking with a genius,
way. Well, I'm sorry.
the
Are
time
too kind.
flies. But there are a few questions I want to ask you before we wrap, and one of them is, what haven't I asked you that you think is important people know during this time of Corona to protect themselves, to prevent spread, and just should know?
You know, when you asked me to for the interview, I told you I'm not an expert on Corona.
Right.
Just, uh, but I mean, the only thing that I can say is very important is that first you have to be very mindful of the things that we read in the media and really listen to the guidelines of official agencies. That is one. The other thing is, I think it's also important that we have to also be mindful that this is going to take a very long time, because before there is a vaccine or an adequate treatment, you are talking about next year. So, in a sense, we have to prepare ourselves for a post-corona.
That's my fear. That's my fear.
Yeah. So, what probably, all those mitigation, social distancing is meant to prevent our healthcare system to get overwhelmed. But at the same time, you can imagine if after 4 weeks or a month, we're losing everything up. It is possible that you get and more infections and then
Another outbreak.
So this is a very difficult to think about, but probably we have to be prepare ourselves for a very long ride.
Have you noticed I'm keeping my social distance from you?
Yes.
It's
You are at the very safe distance.
very safe distance, so you don't have to worry about me contaminating you. Although I know I don't have the corona, I'm not getting it. I made that decision at the inception. I'm not getting it. So, anything else before we wrap?
Well, thank you so much for having me on your.
Oh, thank you for taking the time. And I would like down the road, when you have the time, to do another segment with you on your specialties.
Okay.
Would you like that?
Oh, great! That would be great.
So we'll do that.
I'm doing a lot of innovative things, cardiac surgery,
Great. So we
happy
will
to
talk
share
about
that with you.
I would love that. So I'll be in touch. Thank you so much for taking the
Thank
time.
you.
And even though you said you weren't a corona expert, you were.
No.
You helped. You provided a lot of great information, and thank you for sharing, this time with me. And like I said, I'll be in touch with you, and enjoy the rest of your evening, right? It's evening where you are? What time is it there?
I think it is now almost 9 p.m.
Oh, good. I didn't keep you out of bed. I hope I did.
No.
Okay, great. Well, get your rest and get all rejuvenated and ready for tomorrow.
Thank you.
And thank you so much. And thank you for watching Conversations with Jennylyn, when a conversation is all you need to be inspired. And I will see you next time. Bye-bye.
Bye-bye. Yeah. Thank you. Bye-bye.
Thank you.
Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.